the medical collection of data and the multi-billion-dollar business in personal medical data. And what I've tried to do is bring to life the human impact, what impact all of this trade makes for particular individuals. And it's especially difficult when it comes to medical data to illustrate because, as Deb mentioned, medical data is our most intimate data. And so if this information is in circulation, it's especially damaging potentially, and thus it's especially difficult for people to come forward and tell their individual stories. And I know this also from my first book, in which I wanted to have a few pages on the impact of and the power of your medical data being out there in circulation and perhaps identifiable. So I decided to follow up in the footsteps of my data mentor, LaTanya Sweeney, who you'll hear from this afternoon. Many people had said, perhaps some people can identify data if they are geniuses like LaTanya Sweeney, but most people couldn't do it, so you shouldn't worry about this trade in data. And I thought, well, let me, someone who is not a PhD in computer science and not an expert in this kind of thing, see if I could identify a few people. And I've told a few people this story before. What I did was I found 3 people who were contributed anonymous data to the Personal Genome Project, which is to help science by giving a sample of their genome and a lot of personal, intimate medical detail, which is made available in public for scientists to help advance medicine. And so I searched out through other databases to see if I could identify these people, and I did indeed find all 3 of them. I called them up and said, look, I'm writing this book. May I use your name in this book? Because it's more powerful if you have a real human story behind it. And one of they all said yes initially, and then one of the people I saw after she said yes, I'd noticed that she taught at an institution of, that was a faith-based institution. And I read the rules there, and I saw on her medical chart that's out there in public, one of the things that had happened to her was that she had had an abortion during her life, and she had many other intimate medical conditions that she had revealed in public to help science, but that anyone could see. And so I said, listen, you said I could use your name, but I decided to call her again a second time. And I said, I could use your name, but I see that you've had an abortion, and I'm worried that if I use your name and you come out like this, it could create troubles for you because your institution specifically says not going along with the rules of the faith could create problems and potentially being fired from the job. And she said, oh, I've thought about this. This is fine. So a year passes, and then I get the galleys to my manuscript. And I've not let anyone see of the hundreds of people I've interviewed for this first book, What Stays in Vegas, but I think this is the most intimate of all the data that I have in my book. So I call these 3 people again and say, listen, I wanted to share the few paragraphs about you that I've written that has your name, your medical conditions, and the re-identification part. Here's where I found you, what you have to say about being found. And I sent it back to this woman who already twice the year before said it was fine to share her data. So I email it to her, and she calls me back, and she's just horrified. She says, please don't use my name. And I said to her, well, what happened? You know, we've twice talked about this. And she said, when I saw in print what it looks like, it's just horrifying when you put where I work, who I am, plus all of my medical conditions in great granular detail. Well, that's really quite a blow. And I said to her, well, that's what we talked about. What exactly do you think I was doing? And she said, well, I thought you were writing for an obscure academic journal that no one would ever see. And so coming out and telling your personal medical story is intimate, intimate and very brave for people to do. In this case, I removed her name. That of the second person, a third person agreed after seeing it that it could be in that first book. And so we're quite privileged today to have the opportunity to hear from 3 people who have been impacted directly by the business of medical data as it's now handled in the United States. And so I wanted to have a conversation between the 3 of us, and they're all different kinds of stories. So first I wanted to begin with Mary Ebeling, who is a professor at Drexel University, a sociologist, whose story tells us about the commercial trade from data brokers. Now, data brokers are commercial entities that gather files about all of us for marketing and sales, but it may be less recognized that there is also medical information in there. And I thought it would be interesting to hear from you, Mary, to talk about your stories and impact with data brokers and what you found also as you research this upcoming book on the topic.
Okay, thank you, Adam. So as Adam said, I have kind of a personal medical story related to how data brokers were able to not only access very intimate medical information about me, but it came back to me in the form of marketing, direct marketing. So I'll tell you quickly the story, and then we can kind of broaden it out to a bigger conversation. So a few years ago, for about 4 years, I was undergoing intense fertility treatment at a fertility clinic in the town that I live in, which was connected to a university, a large university hospital system. And during the 4 years of treatment, as I progressed through kind of lower intervention to more extreme interventions, which was not all covered by insurance, I did things like, of course, what everyone does, they surf the internet to look for information about infertility and how to get pregnant. I also, some of my insurance covered some of the treatment, but most of the treatment was not covered by insurance. So I either got financing that was offered to me by the clinic through a third party, or I put a lot of the expenses onto my credit card. Finally, because we could no longer afford to pay for these treatments, when our doctor offered us to enter into a clinical trial, we agreed to do that. Looking back, I'm thinking about all of the different ways that my data was kind of released out there connected to my health. So it was through my surfing behavior, and prescriptions, which I had to buy through, not only through the clinic, but through a third-party pharmacy, a specialty pharmacy, again, using my credit card. So I surfed the internet. I used my credit card to make either to pay for in-clinic services or for prescriptions. My prescription data was also just out there. And then the clinical trial, as well as my health record, both within the doctor's office and then also through the clinical trial, because the clinical trial was being sponsored by a pharmaceutical company. So through those 4 years, I had 3 miscarriages. The last one being the pregnancy was the result of the clinical trial. And during the pregnancy, I began to receive direct to my home marketing materials as if I were pregnant. So within my on the day of my 6-week scan, and I was being scanned very early because of my age, because of the history of miscarriages, and because I was in a clinical trial. That day, I came home and there was a box of Similac waiting for me that I had not signed up for anything as far as I can remember. I did not sign up to receive free samples. And then once that first day of receiving this free box of Similac, it never ended, to the point where when I was miscarrying in my at the end of my first trimester, I received, the day that I found out the baby had died, I received a free subscription to American Baby. And that is when I decided, I'm a sociologist who has actually studied pharmaceutical marketing as a sociologist. So I decided, I think once I got through, actually it took me about a year, but I did not throw away any of the marketing that I received. So I have a whole archive of what I call my marketing baby. And my marketing baby over the years has grown up. My marketing baby kind of came out of infanthood, became a toddler, and is now actually, because this has been a couple of years, is now in kindergarten. So
Meaning you still get advertising
Yes.
for a kindergartner now?
Yes, only online now. I mean, I did start to, I think I started to get some attention when I started to investigate and call Experian. At some point, I actually worked with a data rights organization in the UK to try to get my data profile from Experian. I think the marketing started to drop off, but I still get online ads for early childhood educational software. A few weeks ago, I was at Health Data Palooza, which was also held here in DC, and someone was talking about, again, how health data is this natural resource that we have to tap that runs our engines here in the United States. And I am kind of the dinosaur bones that are being ground up to make the oil to run those machines, and I think we all are. So I just wanted to kind of put that out there. But that's kind of the short end of my story.
So you're talking about a realm of data in terms of data brokers, this kind of specific sort of entity that has your name, address, maybe email, phone number, that's specifically marketing to you. Now, an entire other realm of data that can be of concern is your specific medical data that might be in circulation with your company or others that's also used in ways that you do not expect it. Now, many Americans do not realize that a lot of companies self-insure. So even though if you may receive from United Health or Aetna the insurance forms, it's your company that is paying or footing those bills for the health bills. And so Deanna Fei, sitting here to my right, to your left, was famously sort of outed in a way by the CEO of AOL, who announced that 2 women in the company had been especially costly in that past fiscal year by having so-called distressed babies or premature babies. And Deanna was a speaker here last year who talked in great detail about what that incident was like and what had happened in the aftermath. And she has written this book, Girl in Glass, which is on the table. Now, Deanna, since you've came out in public about the incidents, people have gotten in touch with you. You've become a better known figure who's talked about this. And I wonder some of the experiences that you've had since then, what kind of people you've been in touch with, what have you learned since then?
Yeah, it's been a really interesting journey for me, and I will sort of briefly recap what led me here, because I know that in the conversation about health privacy violations, there's often the question, well, where is the harm? Where are these dead bodies? And even when we talk about harm, it's often in these hypotheticals. But for me, I came at it from the complete opposite direction, where this violation happened to my family long before the term medical privacy really meant anything to me. And after I came forward, I found myself becoming a kind of repository for people across the country to write me about their own experiences suffering similar targeting by their employers, similar instances of being blamed, shamed, in some cases even terminated because of their medical bills. And so it's just become really clear to me that, in my experience, in my own experience and the experience of those that have shared their stories with me, the context here is that the institutions that are likely to hold power over most of us in terms of our daily lives, our health insurance policies, the livelihoods of us and our families, those tend to be our employers, and our employers have more and more control over our medical records. So just to backtrack really quickly, a couple years ago, I was a novelist who was trying to finish my second novel before the arrival of my second baby, when inexplicably she arrived almost 4 months prematurely. And she spent 3 months in the neonatal intensive care unit, 3 months that were very long, dark, terrifying weeks. 1 year later, after she came home, and really, it was actually the same week that she started taking her first steps, suddenly these headlines started to ricochet just across the media universe about these distressed babies. So what had happened was the CEO of AOL, which is where my husband worked at the time, had found himself on the defensive because he had just made cuts to employees' retirement savings plan, even though the company had just posted its best earnings in a decade. And so when he was questioned about those cuts, he blamed these 2 employees' babies. He's said that these babies had pretty much dragged down the company's bottom line. Even though he did not name names, my husband's coworkers were immediately able to identify our family. And the exact same thing happened to the other AOL mom who was on the West Coast but had the same experience. The CEO attached price tags to both of these children's lives. He insinuated that their medical care was extravagant and optional somehow. And also that, of course, is all in the context of singling them out for having drained resources from everyone else, leaving him supposedly with no choice but to cut retirement benefits for all workers. So my first instinct, to be perfectly honest, was to cower in shame, because I had very much internalized this sense that the medical catastrophe that I had suffered was my fault somehow. This is obviously something that a lot of women do to ourselves with anything to do with pregnancy, birth, fertility, and any kind of issues like that. And I had also really never talked about the trauma surrounding my daughter's birth. But as distressed babies became this social media meme, and every cable news roundtable, it was endless. What it felt like to me was that what had been this private shame had become a public shaming. And so I came forward to speak out to defend the basic worth of my daughter's life. Probably to no one's surprise more than my own, the story went viral, the CEO apologized. I forgave him. My husband was not fired for my having become this kind of whistleblower, which I think a lot of people wanted to applaud and say, okay, that's kind of a happy ending, it's a good resolution, right? But I then was waking up to this outpouring of messages from people across the country who were all saying, in effect, you're not alone. And in some ways, they meant that to offer support and solidarity, but in a staggering number of cases, they also wanted to share with me how they had also been victims of medical privacy violations that were similar. And many of them told me that they had suffered in shame and in silence, in some cases for years, even decades. And so that was really what inspired me to write the memoir, Girl in Glass, which is at heart the story of learning to be the mother of a child I knew that I could lose at any moment. But it's also about the idea of protection and exposure, especially as a parent in this age of big data. And it's an exploration of how do we care for the most vulnerable members of our society. Because what I found in sort of looking for the patterns in the emails that I was receiving is that the people who tend to be targeted in this way tend to be women and their children, who, for some reason, medical issues relating to pregnancy, to childbirth, to fertility, somehow these often stand out to CEOs as somehow more optional than, say, back surgery or heart surgery, which are equally expensive medical treatments that tend to affect male employees more. So some of the stories that people have shared with me, one woman told me about a company meeting where the insurance rep stood up and said, rates are going up because someone had twins that cost the company a lot of money. Clearly, people were able to point to who this insurance rep was talking about. Another woman wrote to me about being called into a meeting with her boss, who directly said, you're a burden on the company because she had uterine cancer. I've heard from the other AOL mom who never did come forward, but has given me permission to speak about her experiences. She, after the controversy blew over, she actually unexpectedly found herself pregnant for the second time because of how profound the trauma had been with her first child in the hospital, and then to be singled out in this way. she had not even decided if she was going to keep this pregnancy. It was obviously going to be considered a high-risk pregnancy at that point. And, you know, even just the prospect of showing up to work visibly pregnant while people are very aware that you've already been called a burden on the company because of your first pregnancy was terrifying to her. So before she had even decided if she was going to keep this pregnancy, she was on the she received a whole stack of wellness, pregnancy, welcome to your pregnancy packets at her office and at her home, which were seen by her coworkers and her in-laws before she had told anyone about her situation. Another woman who wrote to me almost immediately after this distressed babies controversy broke out was a woman named Carolyn, who I feel so fortunate to have with us today. I'm going to read a little bit of the email that she wrote to me, because that was at a moment when I was still kind of so steeped in the personal impact that all of this had on me and my family. And when I read her email, it really shook me out of that and woke me up to a whole larger set of very complicated and frightening issues that clearly affect millions of ordinary families across America. So she said, I just wanted to say I'm so sorry that AOL made the public and hurtful comments they made about your daughter being essentially too expensive. Unfortunately, I think there are more companies than we think who either cut benefits or get rid of employees who cost too much with their insurance. I am an example of that. I lost my job December 20th, 2012, Merry Christmas, over being quote unquote too expensive for my health insurance. I had 2 cancers in 1 year, had to work full-time through surgeries and chemo, and they kept trying to push me to quit. Finally accused me of taking the job just so I'd have insurance. I will shortly be homeless because my unemployment compensation has run out. If it gets out there in terms of her job search that I even had cancer to begin with, that info alone might sink my job search. For a supposedly civilized country, we certainly appear to be becoming more and more self-centered as a society. Neither your family nor mine had any idea we were about ready to have the unthinkable happen. Stuff just happens sometimes. We buy insurance for that purpose. Sometimes we need to use it. So I just found that to be such a powerful way to see not only my situation and her situation, but as, you know, clearly something that affects, I think, anyone who might suffer a medical crisis in America today. I want to let her speak to her own story. I do want to say that it's hard for most people who have suffered a violation of this nature to speak up. It's hard to fight back against an employer. People are afraid to lose their jobs. When you're talking about a medical privacy violation, you're often talking about some of the most profound traumas that a person can experience. And also, right at the moment that people might find themselves being targeted in this way, they're often still struggling to cope in the aftermath or in the present of exactly the medical condition that's caused them to be singled out. And I also want to just point out, and you know, I think we'll talk about this more as a whole panel, is that these medical privacy violations don't happen in a vacuum. In other words, in a judgment-free culture about people who suffer medical crises and need medical care. Again and again, I heard from people who told me that, you know, they were singled out in this way as a burden, as a person who was too expensive, as somebody who drained resources from everybody else. So, of course, this larger context is this culture where we treat healthcare still as a privilege rather than a basic human right, where corporations tend to apply this zero-sum mentality to worker benefits, you know, as in somebody's healthcare that has to take away from someone else's retirement benefits, even as, of course, CEO bonuses are somehow untouchable, and where we blame the high cost of care on people who are sick instead of the healthcare industry. So, to me, I've come to understand medical privacy as a civil rights issue, first and foremost. And I am just really, I feel really fortunate to have finally met Carolyn in person over the last 2 years. It's now been 2 years, and I still hear from people who share stories like this. Again, I will say it's hard to come up and to tell your story, and it's an emotional. It's, you know, it can't help but be emotional to talk about a violation that I think, you know, when you're seeing it in the abstract, the language can be so dry and theoretical, but really the impact that it can have on an individual and a family really could not be more personal.
I thought I was prepared for this.
Well, Carolyn, we're not going to provide really any introduction because in the interest of preserving your anonymity, I'll just ask if you might share some things about that story that you first hinted at in the email, and then reveal as much as you'd like to reveal to the audience this morning.
Yeah, and I would appreciate it. I'm probably fairly easy to find, like all of us on the internet. I'm still searching for a job. I'm in a profession that does Google searches. If this comes up on the first page of a Google search, I'll be under a box under a bridge the rest of my life, I'm sure of it. Anyway, I had 2 cancers in 1 year, cancer number 2 and cancer number 3. And I'd had breast cancer when I was in school, and then I got it on the other side. And then later that year, I got follicular non-Hodgkin's lymphoma, which is one of the indolent lymphomas that has no cure. In this job, I did not tell them about the second diagnosis. I waited until I was going to have treatment. And I managed to go to the second opinion without them knowing, because in this particular profession, we have a fair amount of freedom of when we come to work and when we don't, if you arrange it way in advance. And so I finally had to tell them right before chemo. I had other employees and coworkers volunteer to work for me because we had no sick days at this place. And my boss originally said yes, and then at the last minute she came back and said no, and that turned out to have come from up the chain, and as I learned later. The problem here that I'm an example of is that my company, which was self-insured, had the insurance administered by one of the biggest insurance companies in the country, and they talked with each other. And while I was told that talking about my cancer at work was a violation of HIPAA, I don't quite understand how HR came to that conclusion. They violated it, and they knew things and said things to me about stuff I had not shared with anybody. Now, I'm not sure what they saw, because as the victim of this, if they hadn't told me and other people hadn't told me, because keeping their mouth shut where I worked, I was lucky they didn't, I never would have known that this was what was going on. But when they got rid of me, they told me explicitly I was too expensive for their insurance. Now, mind you, both years we got money back. Not lots of money, but we got money back. And I was accused, as she said, of just getting the job for the insurance. How they expected me to eat beyond that, I have no idea. They wouldn't let anybody work for me. I was required to work for other people who were sick, but they wouldn't let people work for me. I was forced to go on a trip. Despite a doctor's note saying that my counts were too low, I got sick. I spent 6 weeks working with a temperature between 101 and 103. I got written up for going home with a temperature at 9 o'clock in the morning, despite getting somebody to come in to work for me. The chemo damaged my bone marrow, which prevented, we had to stop my chemo early because it damaged my bone marrow. It was damaging my liver, so we never got rid of my nausea. I didn't have the follow-up treatment we were going to do because I didn't pass the bone marrow test for it. It was, the cellularity of it was too low. I'd gone from really good to what you'd have if you were 90. And they were giving me grief, even having me have the time to be able to do that, were I to be able to need to do it. When they got rid of me, and I do have a lawsuit against them under ADA, but that's also something that's difficult, and I couldn't figure out, and free legal aid couldn't tell me that there was recourse under anything else, and even if there was, I've missed the statute of limitations, 180 days, that's all you get, is 180 days. And I now have more evidence than I used to based on what the other side unknowingly let loose with the deposition I had a couple of weeks ago. But it's too late for me to do anything. And I was so burned out from what they had put me through that I was paralyzed after the fact. I couldn't do anything. I did the minimum to keep my insurance compensation, and they technically got rid of me by not renewing my contract. But then they escorted me out, told me to pack my desk and not finish unfinished projects that I had, and then didn't pay me the rest of my contract. And so at least I'll get that amount, even though it's for, 10, 11 days? What happened then, and I still had student loans during this, they're in hardship deferment, and I'm doing the have it based on your income really isn't practical because they reset the time to 0. It's from grad school. I got breast cancer for the first time in grad school, and the health insurance had no out-of-pocket limits, and so I borrowed $136,000. I owe $97 right now. If I go into default, they'll take 25% of whatever I make, including Social Security. I've not paid into retirement. I mean, the financial results of this have been devastating. I go to one of the major cancer centers. I found out this morning, or yesterday morning, when I finally threatened to out them here. They called me back. Legal there called me back. But what she was talking about big data, for the last 3 weeks, I'm at one of the cancer centers that's sharing data. Deb told me about that this morning. They're sharing data, and we don't get anything from it. Well, what they're doing right now is I see between 17 and 25 banners a day from my cancer center. I've probably relapsed. I moved my appointment.
You mean internet, when you're looking at the internet,
Yes.
you see banner advertising on various pages?
Yes.
Related to medical searches or anything?
Anything. I could be on Yahoo and it comes up. It comes up in the sidebar of my Yahoo email.
And specifically your ailment, not other
Not
ailments unrelated to
specifically
you?
my cancer center. I've started to getting ads about Rituxan, and that's about ready to go generic, and I'm presuming that some of the ads I'm getting are from companies that are going to sell generic. And the Rituxan's one of the treatments that you get with non-Hodgkin's lymphoma. And so I called them upset. I thought it was linked with appointments, which were actually yesterday and today, to come here. And they weren't getting back to me. And so I called them back, and I threatened to out them here today by name. They called me back. Marketing left me a voicemail that I haven't called back yet, claiming, it has nothing to do with any of this. And after what I've learned here, I seriously doubt it. But when you have cancer without a cure, it's got a longer lifespan, but when you have cancer without a cure, when you think you've relapsed, you really don't want to go through every day being reminded 17 to 25 times that you have cancer. It's really hard on your mental health. And that's happening. I don't know how to stop it. I need to deal with that when I get back home. My finances, let's just say I'm out of money. There came a point where I realized that this was not going to end as soon as I thought it was going to end. I have a gap in my vita. In my particular career, that's incredibly damaging. Also, although I don't look it, I turned 62 last October, and it's very difficult to get another job that way. I'm out of savings. I looked at the situation, and I thought, I've got to make a choice here. Health insurance or rent. My state didn't expand Medicaid. I don't get a subsidy. I'm paying $957 a month for health insurance with a $5,000 out-of-pocket, et cetera, and the copays never quit. And so, of seeing doctors. And I take home right now $839 a month. Clearly, we have a problem. So I chose homelessness. I have a 1988 17-foot little Toyota Sunraider. It's a little Class B camper. And I was living in that until a friend took pity on me and asked me to live in her leaky basement. Literally does leak. I mean, we spent time bailing it. To watch her 7 kids because her husband had been transferred. They moved then last September out to where her husband was. I lived back in the camper for a little while, so legally I'm homeless technically, except when I was in the camper and Walmart parking lots and whatnot. Technically I wouldn't be so, although what I was living in was interesting. Asked me to watch their cow farm for them. I was out there 3 weeks. They came back, asked me what I was going to do next. I told them that I was back to my camper, and I was glad that the summer was over because it's blessed hot in a camper in the summer in where I live. And they invited me to live in their repurposed shed. They only have one bedroom at their farmhouse. It had holes the size of my fist. I filled it with Expando foam. I had buckets under the leaks. You had visible mold all over the place. But you know what? It had electricity. There was a shower in the house. There was a kitchen. It was great. I finally got into HUD housing. That 2-room apartment is in a very interesting part of town that I wouldn't normally choose to live in, and my apartment is smaller than the hotel room I was put up in last night. But I've got a roof over my head there. Unfortunately, my expenses have gone up. I pay $125 a month for rent and utilities. My income hasn't. If I can't find substantially more employment, I'm going to be back to being homeless. Partway through this, some friends pushed me to create a GoFundMe. I didn't want to do that. You know, it's embarrassing. Excuse me. To be begging. And I finally did it. And in the adoption community, they paid it forward. I've spent years on the phone with folks who've adopted troubled kids like mine, you know, helping them through the hard periods. I've taken some of their children into my home when they've needed a break. When a kid has attachment disorder, it can be horrible living through what goes on. And so they wanted to go on vacation and just get a break, so I'd have their kid in my home. I took a Chinese kid, not to leave the Chinese part out if you're writing about this, I took a child into my home who disrupted out of her adoption 2.5 months after in this country to keep her out of social services. I did that shortly after my chemo ended. She then later got readopted, but these folks have paid it back to me. I got nearly $16,000 that way, which helped keep me in health insurance. I've gone through that finally over the last 18 months, and we're back to where I started from. If I declare bankruptcy, and you all know that so many bankruptcies are because of health insurance costs. If I declare bankruptcy, I can't do that because my cancer center, one of the big ones in this country, will not see me as a patient. I've already been there, done that once, and I had to get caught up on bills there. I have a payment plan that's increasing faster because of the visits. I mean, the visit I'm going to have in mid-July, that's when the next appointment was. So why they're advertising, I have no idea. Too many patients, not enough support staff. Do we really need more? But anyway, it'll probably push my payments up another $110 a month. I don't think I can talk them down this time. So I'll be pushing close to $300 a month with that. I'm selling my belongings, the things that I've collected my whole life that I've saved for. I mean, when I first was employed, I had a mattress on the floor and my clothes were in cardboard boxes. Why? I didn't want to buy junk. I wanted to buy nice things. They're mostly gone. I don't even have a couch. They're mostly gone. And that's what's kept me solvent in this country.
So
we're not worth much. And in order to keep treatment for this cancer, and my daughter needs me. She's not a child who's ready to be independent yet. And I no longer have money that I can give her in a trust fund to try and keep her in a house. She's homeless too, couch surfing with 2 kids and a third one that'll be born later this week. That's why I'm not staying here very long, because she's due Thursday or Friday. And if you want to talk to me later, I have a little card I made up that can tell you how. I'll leave some with Deb, but I can hand some out now. I'd love to take her in to live with me, but I can't even do the things my daughter needs. I give her some of my food from my food stamps because I can't stand that the children don't eat balanced meals at times. I don't have a way out of this. I've got part-time contract work. I may have something else coming up, but you know what happens when I have that? I lose my food stamps. I lose my hardship forbearance on my student loans. And my rent will go up because the rent is income-based. So it's going to get worse before it gets better. But I don't dare not take that because how else am I going to get full-time employment? I'm a professional. This can happen to any one of you. I'm a professional. You know? I have a job that paid fairly well. I was saving. It's a darn good thing I was saving. I didn't have just the 3 months worth of a safety fund. I had more than a year. It took me, what? It took me, 19, 18 something months before I ran out of money. I was given permission. Excuse me. I was given permission to give you my GoFundMe. I've changed my Facebook name so that it can't be tracked down to me. I've done extensive searches on my name. My photo is not on the internet except through the GoFundMe. That comes up on page 1 of a job search, but it's gofundme.com, 78 D like in David, 3 N like in Nancy, C like in Candy. And I cannot begin to tell you, as somebody who has worked since I've been 14 years old, how horrible it is to be in a situation where I've had to beg to have health insurance, to pay my medical costs, to know, because I have B symptoms again, that I've probably relapsed. But what hurts even more is how this has affected my daughter. I have a child who needs me. I can't do what all of you would do for your children. If I give her $30 for gas, I have to think about, okay, what can I sell to do that? I'm wearing a suit because that's what I normally wear to work. You know, that's how come I look respectable.
Let me thank you so much for this intimate story. As Deanna has said, it is so difficult to come forward with a story like that, and obviously...
And I apologize for crying.
Well, it's obviously extremely emotional. I wanted to link back to something you were saying before with what Mary was talking about on this targeted stuff. So this targeted advertising is coming to you, reminding you of your condition. Now, Mary, you, through your research, have tried to go back and find out where it is and perhaps stop it. And I wonder if you succeeded in your efforts.
Not entirely. So basically what happened with me and how I was able to kind of figure out who owned my data was at some point, it was actually 10 months after I had my final miscarriage, I got a letter inviting me from, again, the same university that I was going to for fertility treatment. It's a huge university in the town that I live in. And they have an infant language research lab. And so the letter was sent to me, inviting me to bring in my infant to participate in research and this early language acquisition research. So being a sociologist, I knew that they had an IRB. I knew that they had to tell me how they got my information. So I called them up, and they were appalled, shocked, to find out that I did not have a baby. And of course, they don't want to have that kind of harm done to potential research participants. So they promptly, the woman that I spoke with promptly looked up on her computer and found out that they had bought a database of about 1,500 new parents in the area from Experian. So with that information, and she was able to give me, what data they had bought on me in the database, and so including in that information was the birth month and year of my child, which was the same birth month, or the same month and year that I miscarried. So armed with that information, I was able to kind of figure out actually that Experian owned the data, but that they had sold it to a list broker who specializes in putting together new parent lists. And that was ALC, is the list broker. But when I called up the list broker, of course, they were very clear that they actually didn't own my data, that Experian owned my data, and they were leasing my data from Experian.
So in essence, you can't really it's still out there in circulation in some form.
Absolutely. Because Experian, of course, when I interviewed another data broker who's not, involved with Experian, he said to me, and it's in my book, he said Experian owns us. And they do, because they own the FICO score.
The interesting thing, by the way, is that your data individually sold might be worth 8 or 10 or 15 cents.
Right,
So
but
all-
millions sold.
Millions sold is very substantial
Right.
revenue, but the pain that you're talking about comes from, that sliver of money on an individual basis.
Oh, absolutely. And the fact of constantly being reminded, this is why I call this baby my marketing baby. And I wrote this book to as a detective, actually, and I was pursuing this mystery person that I knew existed, but I had never seen or held or touched. But regardless, lives and breathes in Experience's databases, as well as many different databases that I have no idea. Experian owns about 98%, holds data on about 98% of households in the United States, and they operate in 38 countries currently. It kind of goes up and down. They own similar amounts of data on citizens in those countries that they operate.
I wanted to ask if we have time for a question or two from the audience. Let's take a question from the audience. There's a microphone right behind you, if you don't mind. You right there, if you could, over there, please. And if you don't mind stepping up to the microphone. Let us know who you are as well, please.
I'm Arthur Allen. I'm a reporter for Politico. I just, many of the stories that you've told, I'm trying to figure out how they have to do with privacy. Because, they do in various ways, but, I'm sorry, the director,
Mary.
Mary, your story is about a mistake, about imperfect data. That, in a way, that's really what it's about. And so that's the story. The fact that we all get these banner ads and garbage that we don't want is a symptom of the fact that this data is owned and controlled by others than us. But in your case, it also shows that it's less powerful than we might think, because there's so much stupidity attached to it. And then with Deanna, I was just, your story in some ways, is it a privacy story or is it just an abusive boss story? And I guess I was wondering also about your story as well. And I guess a lot of these stories seem to have to do with how our medical system, our healthcare system, is based on these, depending on employers who, in the capitalist system, are trying to maximize their profits, and so, of course, we're an expendable part of that, the cost when we're employees. Anyway.
Yes, go ahead.
Can I just quickly respond? You're absolutely right that, all of our stories has something to do with kind of medical capitalism. But I think that the fact that our first speaker brought up the Hippocratic Oath, and that that's a 2,000-year-old oath to protect the intimate secrets of patients. And although I was able to determine that it's most likely that my doctor did not sell my data, the medical system definitely did. And as a patient, I really don't have a choice. And that is why privacy is kind of at the center of this. Even though it's all of these other things, this is my body, and I don't want it to be mined for profit.
We only have 2 or 3 minutes left, so if you can...
Yeah, well, I think, of course, it's true that any story like anyone's life and anyone's body and anyone's medical issues and anyone's employment, touches on a lot of different complicated issues. I think it's also very clear that privacy is a hugely important component of all of our stories. I mean, medical privacy, if we had real medical privacy, the way that I think any layperson would understand it to protect your rights, should be a shield to protect, say, your CEO from knowing intimate information about individual employees. That's not something that any CEO should have access to, and yet many of them do. I'll just really quickly share a very brief anecdote that illustrates just how dangerous this situation is. I have a good friend whose husband runs a company, and they only happened to tell me the story because they had read the book. He was the COO who got called into a meeting with the insurance rep who said to him, you know, there are 2 people at your company who are driving up costs. Do you want to know who they are? That is, I think most of us understand, morally wrong and illegal, but I think the fact that there's any debate over, well, is this a privacy issue, is this a legal issue, is this a HIPAA issue, shows just how weak and outdated the laws are that are supposed to be protecting ordinary employees in this way.
Yeah, and my problems were directly because my insurance company that administered the program for my company shared information, and they shared intimate details of what the insurance company had access to, because I had not talked much at work about any of the medical details that they knew. And my impression was, and grant you I'm a layperson when it comes to this, not like most of you, is that what happened at the cancer center, what happened with my insurance, stayed there, as you said, in Vegas.
I wanted to just say that the one final point on your question there is that tomorrow I'll be talking about the evolution of the business of anonymized patient data and how there has evolved dossiers on most people in this country and in many countries that's commercially sold. And I'll go into that a little bit more tomorrow morning. As I said earlier, this is a rather extraordinary session in the sense that we've had 3 people who've been willing to tell their intimate stories in a public audience, and I really wanted to thank all of you. Unfortunately, we're out of time now, but those were around. Carolyn is leaving very shortly, so I know she's happy to talk to people, but now in this break might be a good opportunity, and others of us will be around longer through the conference. But thank you all to the panel, and thank you to the audience for attending.